I'm 42 years old and have under-eye puffiness and dark circles. What treatment would you recommend? Hi all, I am 42 years old. I have had puffy eyes and dark circles as far as I remember, but it has become much worse. I'm considering eyelid surgery. The only thing is that sometimes the puffiness becomes much less, and my eyes become bigger and nicer, and the black line is also easy to cover. This doesn't happen very often, maybe once a year for a couple of days. If it is permanent fat under the eyes, why does it sometimes become less? If I get the lower eyelid surgery, would I still get puffiness? Thanks.
Thank you for your question. You're 42 years old. You've submitted some very useful photos to describe what your main concern is, which is puffiness under your eyes and dark circles. You also mentioned in your question that there are times when the puffiness is better and that it's easy to then conceal the dark circles. And you want to know, can the puffiness come back after surgery? So as a cosmetic oculofacial plastic surgeon for 20 years, practices in New York's Upper East Side in Garden City, Long Island, you can appreciate that we see this type of issue every day in our practice. So I'm going to begin to help you with your question by first answering some of the things that need to be answered first. Number one is, what is the puffiness? The puffiness is caused by something we call lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that is normally around the eyes will push forward, and in some studies have been shown to actually increase in volume. When it pushes forward, it creates a bulge, and that bulge is like a hernia. That's why we call it herniated fat. The strategy for treatment of that herniated fat is to do some type of procedure to reduce and sculpt as well as reposition. The other side of this issue, of course, is the dark circles. Dark circles under the eyes are typically a combination of genetics as well as such as pigmentation, that is ethnic, sun exposure or environmental changes, as well as the quality of the skin being so thin that you can actually see through the skin and see the blood vessels as well as the muscle underneath, and sometimes in the case of people with allergies, to be dark in a term referred to as allergic shiners. So with that understanding, let's also appreciate a little bit of why there is variability in puffiness. It is very well known that the fat pockets under the eyes are affected by fluid in terms of the fluid that is important in the response of the body to situations such as allergies, sinus issues where there is backup of fluid. Sometimes people have food sensitivities. Lack of sleep will cause puffiness. So when we're talking about that type of puffiness, we're talking about fluid as opposed to volume caused by anatomy of fat. So in a situation like yours, and this is in the absence of a physical examination, we would typically do a procedure called a transconjunctival blepharoplasty. A transconjunctival blepharoplasty involves the strategic reduction of fat pockets from the inside of the eyelid, avoiding an external incision, as well as repositioning and sculpting as is appropriate. When we do this, we also combine this with a concept of PRP, or platelet-rich plasma, which is drawn from your own blood to help accelerate the healing process. When we deal with the dark circles under the eyes, we typically will first do a platelet-rich plasma treatment under the skin to improve skin quality, and we will also combine that with a procedure like fractional CO2 laser. The combination of treating the physical volume as well as the skin quality yields a lot of really, really nice results that our patients really appreciate. To answer the question about puffiness afterwards, I always tell my patients you still have to manage fluid. And so if it's allergies, treat your allergies. If it's sinuses, treat your sinuses. If it's related to salt intake or other types of foods that might cause the fluid to occur, then you have to be careful about adjusting your diet. That being said, the fluid that causes the puffiness to be as pronounced as it is now in the presence of the fat pockets rarely ever is the same level as you are experiencing with the fat pockets the way they are. So I think that you will benefit from a surgical procedure. And at this point, I'd recommend you meet with qualified, experienced cosmetic surgeons who have a lot of experience with eyelid surgery, who can guide you further. The thing that we can't do in a discussion like this is a physical examination. So judging the integrity of the lower eyelid tone, the canthal tendons, and the skin quality is a three-dimensional experience. So I think at this point you should meet with the doctor. But I think that judging by your photos, you would benefit from a surgical procedure with the combination of these other things such as PRP and fractional CO2 laser. And I think regardless of the amount of fluid you get afterwards related to other issues, you will see a benefit. So I hope that was helpful. I wish you the best of luck, and thank you for your question.